Umar says, I have a sensor that sticks onto my arm to monitor my blood sugar levels. It's much better and easier to monitor by diabetes, or to monitor my diabetes. I cannot take it off as and when I feel like to. Is it okay to do ghusl with this? The sensor is usually placed in a person's shoulder or somewhere on his body, which without any doubt constitute a barrier from water reaching the skin. And we know that if there is a barrier that prevents water from reaching your body organs when performing wudu or performing ghusl, that this is not a valid wudu or a valid ghusl unless there is a justifiable, legitimate Islamic reason for that. So yes, when a person has a bandage on his arm, or if he has a cast because of a broken limb or something, he cannot remove that. He cannot wash underneath it. So wiping over it would do the job, whether it's ghusl or wudu. But with such senses, or in other cases when you have nicotine patches, or when you have contraceptives, some women have a special plaster they put that prevents them from conceiving. And then they ask about ghusl. Putting these things is not a necessity. It is not like when someone is having a cast or a bandage over a wound that he must have it, otherwise harm will get into it. You can always measure your diabetes with the normal procedure that everybody does, pricking your finger and getting a sample, and that's it. Yes, this one is convenient because you just scan over it with the machine and it tells you your diabetes levels, but it's not a necessity. Hence, you do not have the permission to have it on and have ghusl with it on, because it prevents water from reaching your skin, and Allah Azza wa Jal knows best.